Namaskar, I am Gayatri, your anchor for today's Cardio Kidney Metabolic Connect talk show held in Cardiology Conference in Kolkata. In our initiative to build mass awareness about cardio kidney metabolic diseases, which is impacting every Indian household in current times because of growing incidence of sudden heart attacks, kidney problem and diabetes. To throw more light on this, today we have with us Senior Professor Dr. Justin Paul from Tamil Nadu. Welcome, Doctor.
Welcome.
Doctor, can you briefly introduce about yourself to the viewers?
Well, I am Dr. Justin Paul, a professor of cardiology and heading the department at the moment at Madras Medical College. I also run the cardiac heart attack management program at Tamil Nadu as a nodal officer. And I am interested in developing heart attack management systems across the healthcare community, presently involved in Tamil Nadu. I'm also interested in helping out women with heart disease going through pregnancy. These are two areas where I focus my work on, in addition to treating the patients and training my students in cardiology and a couple of other areas.
Thank you, Doctor. Doctor, my question to you is, can a perfectly healthy person get heart attack?
Absolutely. And many a times what happens is, we did a study, in fact, and we published in a journal called Global Heart, where we found that 25% of the patients who had a heart attack never had any risk factors or commonly known risk factors like diabetes or hypertension or cholesterol or smoking. So these risk factor naive patients had a heart attack. So there are definitely a lot of risk factors which we are yet to identify. So many times we tend to think if the sugar is normal, BP is normal, or what we are able to measure comfortably, we think if the parameters are fine, we are happy. But there are many unmeasurable parameters that cannot be measured, but they count a lot. So, for example, the number of hours you sleep, or the amount of happiness that is in your heart, or amount of peace that is in your heart, the amount of exercise that you give it to your body, so many parameters. What we commonly nowadays we call thin fat Indians. Like, for example, we may not really look very fat, but then the fat will be accumulating in different parts of the body. So we may look thin, but then the visceral fat may be more. So there are so many risk factors we are yet to work on. So it is very important that it is not just the visible or measurable parameters that we need to focus on. We need to focus on unmeasurable parameters like the state of our mind, how healthy our mind is, how healthy our thought is. All these are very important. And that is one reason I think heart attacks do happen in patients without known risk factors or apparently very healthy general population.
Thank you, Doctor. My next question to you is, how can we differentiate pain caused by heart attack and pain caused due to gastric trouble?
Well, this is a very interesting question. Commonly, the type of patients that we see, they're coming to us, doctor, I have chest pain. So many times we find out that these patients have a gastritis. One way I can tell you, one secret that I can tell the listeners is that how to identify, you yourself can identify. One common thing is any pain that comes on walking fast and that goes immediately on taking rest. Not necessarily pain, any symptom. Above the area of your belly button and below the area of your jaw, any symptom that comes particularly on walking and that goes on at rest. When you take rest, it goes away. Some choking feeling, some burning sensation, some kind of, particularly if you walk after a food, if you get those symptoms, they're very much likely to be a cardiac pain. But if some patient comes to me and say, doctor, I'm very fine when I'm walking, I'm able to walk 5 kilometers or 6 kilometers, I'm able to climb 3 or 4 flights of stairs very comfortably. But when I come back and do my work and then sit and relax, I find this kind of pricking pain or coming here. This may not be heart. So another important thing that you need to look at is it related to the food that you take? If you're commonly linked with burping sensations or burning sensation, particularly after a certain kind of food that your stomach doesn't take, it could be gastritis. Maybe if you just press the upper part of your stomach, if you have some pain, it could be gastritis. We call epigastric tenderness. It is a physical finding that we doctors elicit, but then when patients come to us so frequently with this kind of pain and panic, sometimes I tell them, particularly intelligent patients, if we just tell just press below the point where your ribs meet gently, and if you have a pain, it could be an indicator of gastritis. But This is not for you to test yourself and decide that you don't have a cardiac pain. This is just a clue. Ensure that you meet the doctor and ensure what you are really having.
Thank you, doctor. Now your message to the viewers to keep their heart healthy.
Well, I say that to keep your heart healthy, you take care of 3 E's. Your eating habits, your exercise habits, and your emotions. Eat healthy. Ensure that you don't take junk food. Eat the appropriate quantity of proteins, appropriate quantity of carbohydrates. The traditional Indian diet is almost 90% carbohydrate, but what we recommend is only 55 to 60% carbohydrate. You need to increase the protein content in your diet and ensure that you are not overweight. Don't eat more. No fasting, no feasting. Have a balanced diet. So eat healthy. Exercise healthy, the second E. Go for walking on a regular basis, 30 to 40 minutes per day, at least 5 to 6 days a week, and do other kind of even mild weight training exercises to ensure that the muscles of your body are kept well. Even the older people, I recommend that to avoid frailty from taking over. Ensure that you do small dumbbells like 1 kg or 2 kg for the forearms and arms, and ensure that your muscles, you don't allow them to get waste. And the third E is the emotions. Keep your mind healthy. Keep it happy, joyful. Don't have any kind of bitterness. Don't have any chains of unforgiveness in your heart. Forgive people. People are there to make mistakes. Don't take it to the heart. Don't have jealousy. Don't have bitterness. But instead, fill your heart with love, joy, and peace, and you will be happy and healthy. These 3 E's: exercise healthy, eat healthy, and emotions healthy. Thank you very much.
Thank you for your valuable advice on how to keep our heart healthy and also protect ourselves and our loved ones from cardio-kidney metabolic disease. For more information, log on to Cardio Kidney Metabolic Connect and also follow the page on Dil Se Dil Tak Healthy Heart Talk Show on Facebook, Instagram, Twitter, YouTube. Thank you so much.
Thank you.